Welcome back to part two on background. I'm going to back up about 30 seconds from where our last video left off and go back again to our demonstration of doing this literature search using PubMed. We demonstrated converting the PICO question into each element of the PICO question into search terms. We saw how that was so narrow it gave us no results. So then we began to broaden our search terms to see if we could get literature that was related to our practice area, but perhaps a little bit more broadly. And then we saw, using those broader search terms, we got hundreds of articles. So now we're going to turn to look at how to broaden and narrow results using some advanced filters on PubMed. So here we are back with our search results. You can see we have 61 manuscripts that we found. You can go in and begin to limit these, for example, by article type, whether or not there's free text available, when it was published, and where the studies were conducted. So let's go ahead and make those limits. Let's start with one of the simplest filters that can help us. Let's select text availability where it is only available in full text. So it's not going to give us simply abstracts. So after we select that limitation, let's see if it gives us any utility in finding manuscripts. So that took us from 61 to 56. So those are the ones that we can access as full text. And we may also want to limit by the kind of study. So if you go into the Customize option, you can see there are a whole host of study types. Now, Melnick suggests that when you're doing an intervention study, you look for synthesis documents, such as review articles, meta-analyses. But since this is on an intervention, it's not a drug intervention or a physiologic intervention, it's a psychosocial intervention using motivational interviewing. And in that situation, we probably don't want to limit ourselves simply to randomized clinical trials because we'll probably get very few results. But we can do that just to demonstrate the process. You can scan through the article types. And let's go to a meta-analysis. But since it's a social intervention, there might be some metasyntheses, so bringing together qualitative studies. Let's look to see if we have any we can limit to that option as well. In alphabetical order, I see we have reviews and systematic reviews that have come up. And let's go ahead and limit those, because I don't believe PubMed lists metasyntheses now that I'm thinking about it in those terms. But by listing reviews and systematic reviews, we hopefully will catch some of those aggregate findings. Let's go ahead and run that limitation. So we see in this instance, running the search with those restrictions didn't reduce the total number of manuscripts we have. So we could limit our studies further by looking at ones that only came out within the past 5 years, 10 years, such. So for the sake of discussion, let's just limit it to the past 5 years. So that takes us down to 40. Now, there's no cookbook formulaic strategy for creating searches. Melnick gives you some great guidance, but partly it's a dynamic interplay of art and science between your knowledge of the context, your skill in research, finding research articles, and established basic principles like converting your PICO question into search terms. So you're going to be always refining this skill set. And you can see as we've gone through this process how filters narrow down our results, how expanding our search terms to move from motivational interviewing ART adherence, which is very discrete and narrow, to adherence more broadly, we got many more results. So you can go through here and you can click on the articles and see which ones might be most relevant to your situation. If you look here, here's one brief patient and provider intervention to improve quality communication. So it might be more provider-centered than we're looking for. Now here's an adaptation of a med adherence intervention to adolescents. So that one probably is worth looking at. And we can read the abstract and see if it fits. So as you skim the abstract, you see that it has taken evidence from adult interventions and adolescent qualitative interviews. So they've blended evidence to create this Positive Steps program, which is a 5-session positive strategy enhancement for problem solving. And it's blending cognitive behavioral techniques with motivational interviewing. And so they talk about how this intervention was used in an adolescent population. And so that might be a very relevant article for us to add to our collection. As we skim the titles, we see here number 6 is the efficacy of an alcohol-focused intervention to improve adherence to ART medications and to improve HIV treatment outcomes. And this is a randomized trial. So this might be, again, worth looking at given our patient population. So if we open this up, we can skim it and see if it fits. Now when we open it, we see that this is actually a trial protocol listed here, which means they don't have any data yet from their work. But in their background section, they talk about how there's little literature showing the link between alcohol-focused reduction interventions and ART interventions to improve ART adherence. So they were adapting motivational interviewing here and problem-solving therapy for HIV patients. And you can see it was registered in the Pan-African Clinical Trials Network. So this one, a trial that's run in Africa, we don't know if it's East Africa, we don't know if it's West Africa, South Africa. So that certainly could have a bearing on its relevance to our setting. But in general, the fact that they use motivational interviewing, they're talking about HIV adherence, means that there might be some good data on background, or this could potentially provide some ideas for the intervention that we use. So that one could also easily go in our collection. So here we've worked together. We've used PubMed as a case example of creating search terms from our PICO question, broadening the search terms when our PICO is too narrowly defined, and then narrowing the results to most strategically fit with the literature that we're looking at. There's an art and a science to this, and you'll continue to develop the skills you already have and bolster them throughout the course of your literature looks here in DNP1 and as you move forward. So this week in your assignment, you're going to write your PICO question, identify the database you're going to search and give a rationale for it. You'll give us the search criteria you used, and then provide citations for 10 manuscripts that you see as relevant to your DNP project and the PICO question that you've created. So as we look ahead to our subsequent week, we're going to look at how to summarize the evidence. Right now, you're beginning the process of locating and identifying evidence for your situation. But next week, you'll be synthesizing 5 manuscripts. You'll be taking the findings of 5 key manuscripts that you identify and then putting in your own words the key findings from those, specifically with an eye toward your DNP project and how you'll apply it with your clinical practice partner. So that's our second piece, looking at background literature. We've worked through Melnick's evidence-based practice process. We talked about cultivating a spirit of inquiry, framing a clinical practice question using a PICO format, and then searching for the best available evidence. So have fun. I hope you find some delightful surprises, some great insights, and some helpful literature to guide your transformation process this week.